Welcome to our YouTube channel. This is Nick with Advanced Stage Management, and I'm going to teach everyone how to draw your testosterone injection. So the first time you receive your testosterone, you'll have two 5 ml vials in this little Ziploc bag here and your pharmaceutical script attached. So when you open up the first vial of testosterone, you'll notice there'll be a little plastic safety cap on there that looks just like that. And we're going to remove the cap. And that's just to make sure it wasn't tampered with by the time it left the pharmacy and got to your doorstep. And then we're gonna get some 70% rubbing alcohol, 70% isopropyl is perfect. And then a cotton swab. And then every single time we use this vial, we're gonna get this cotton ball damp. And then starting in the center of the vial, we're just gonna do little concentric circles, working our way out and sterilize this vial every time before we use it. Once the vial is clean, we're gonna open up a syringe. And the pharmacy will send you some 1 ml, 1 cc syringes, all designed for one and done use. And you can see at the top here, it's very easy to open. So we're just gonna peel this back like a banana. And the way we're gonna do this is when we remove the syringe, we're not gonna touch at the top or the hub. We're gonna keep that as sterile as possible. And then depending on your dose, I'm just gonna use 0.6 for the example. I'm gonna pull this plunger all the way down to 0.6. And if you look at the syringe, you can see the 0.6 and to the left, there's a thicker black line. And if you look at the plunger, there's those two black rings. The ring closest to the top or the hub, I'm gonna use as a gauge. I'm gonna draw back my syringe until that top ring splits that 0.6 right down the middle. Once I draw back on the plunger, I'm going to open up a syringe or a needle. And there's gonna be two needle options. There's gonna be a 21 gauge needle and a 25 gauge needle. Your 21 gauge needle is a little larger and thicker, and we're gonna use that to draw. So it makes it a little faster and easier. So at the top of this needle, I'm just gonna pull back, just like a banana again. And I'm just gonna attach the two together and screw that 21 gauge needle on nice and tight, just like this. And then pulling away from you, you can take the safety and remove it. And you can put the safety cap right down there on the table and just make sure you don't touch the needle at all. And then taking your vial of testosterone, since we already sterilized it, if you flip it upside down, and you can notice the stickers when they're on both sides, so you can see inside the vial, you're just gonna stick the bevel of the needle into the testosterone until the needle is inside the test. I'm gonna push that 0.6 mLs of air in there, which will create a little counter pressure, which will make it a little easier to draw. So slowly drawing back, I'm just gonna slowly pull that plunger down and you can see the testosterone filling up. And then I can go a little bit past that 0.6 and just kind of let it slowly go up. And I'm just gonna keep pushing all the way up till all the air is out. And then from here, I can just draw back a little bit slowly until that ring closest to the top splits at 0.6 right down the middle, just like this. Once I'm good, I'm just gonna flip over and remove. And then anytime you enter that vial, you could potentially dull the tip of the needle. So we'll never use this draw needle to inject. And if you just take your safety, let it touch, drop, click, and if you twist away from you, this cap comes right off and we'll never use this again. So we can discard. And then you're gonna take your 25 gauge needle and the same concept as the draw one, we're gonna pull these little parts apart. And then we're just gonna fasten this on nice and tight. And then you can take the safety and pull the safety straight away from you. And then from here, there's a little air left over in that new bevel. So I'm just gonna push one little drop of testosterone out of the top. And then once you do that, that'll clear any air out. And then you are locked and loaded, ready to go.